Is anyone out there?
Okay, here it is. So that should be... That's
the correct one?
Yeah, I didn't have it on live. I think I had it on like just record a video or something like that.
Oh,
no,
before?
It wasn't before, yeah.
I think it's all live. Okay. So we are tired, y'all.
We're not. No, we're not. We're not.
We're not? I don't want to share that one.
We are a little bit. We're good. Happy Friday, everybody. We're going to talk about inflammation tonight. Inflammation, which is kind of what we were even talking about last week a little bit, but not really. But, you know,
it
ties in with gut health. So
it does tie in with gut health.
When we're talking about all of the things, and what affects what. Hey, we are recording. Y'all have to stay upstairs, please. Thank you.
So inflammation does...
Okay, we're not going to throw ice at each other. Do you guys need to go back outside?
Okay. Oh, I got to turn this on because we'll hear our feedback.
Okay.
So we're talking about inflammation today because it ties in with gut health and everything. So we talked about gut health. We probably need at some point to talk about gut health again. I have gum too. But inflammation is something that we think, how do we think about inflammation? So everybody talks about I'm inflamed, I have inflammation, and so what does that really mean? So joint pain, autoimmune, what else? I can't see anybody who's talking over here.
Guts.
Yes, so...
Diarrhea, upset stomach, colic, irritable bowel.
But I think we associate inflammation with pain a lot.
Yes.
And then we say, why do we have inflammation? So there's a difference. There's acute inflammation, which is actually healthy.
Okay.
So this is...
Oh, yeah, for like if you cut yourself or something like that. Or if you
fall while... you can't see it while you
Are you going to tell everybody what happened?
Sure.
Now, since it's all healed up and you can't see it.
100%.
It happened before. Before we even came on last week, she just didn't want to say anything to y'all because she didn't want you to.
I fell while I was running.
Yes.
The Fortune Park.
The Fortune Park.
In front of everybody.
Which is a very, very busy street in Tulsa. It's like one of the main intersections.
I don't think very many people saw me. So if you saw somebody in a pink tank top fall and pop back up.
That wasn't me. It
was me. I bloodied my arm pretty well. It was dripping blood.
It doesn't look bruised though.
My knee is bruised. But it's okay. I'm tough. It makes you tougher, right?
It does.
So, but I needed inflammation at that point because it's the body signaling for certain cells to get there and do healing, make sure you don't get infections, and so it brings healing.
Off of this one. Okay, go ahead. Sorry.
But chronic inflammation is the issue that we have. So chronic inflammation is where is associated with chronic disease.
Yes.
So if you have a chronic disease, you're going to be battling chronic inflammation whether you realize it or not. This is going to be chronic diseases such as autoimmune diseases that Montika had talked about, as well as diabetes, even obesity. All of those things can cause chronic inflammation, which can be detrimental to the body. It can cause other issues, and some of the issues can be permanent. Damage. So if we're talking about some autoimmune diseases like lupus or rheumatoid arthritis, those can cause permanent joint damage as well as permanent kidney damage. So we have to keep that inflammation in check. And so we'll talk about some things that can help with that.
Okay.
But pain is one of the main things. So if you have chronic pain, you're going to have inflammation. Sometimes pain, you don't even notice you have it, but a lot of people will notice if they get a massage or somebody's rubbing them, like, hey, that hurts. Why does it hurt when you touch me? That's really not normal. If you're having that, then we need to talk about why and looking at those types of things.
Really?
Yes. Why do you hurt when you do
No,
that?
I just I don't know, because deep tissue massage to me is like...
It can be painful.
Okay.
But I'm talking...
I didn't know I was like, that means I'm broken. I mean, I know I got some inflammation, but to me it's like, ring.
Yes, no, that's a little different.
And then my muscles tense up the more they're going, ring. And I'm just like, oh my God. So yeah, I know some people love it. I'm not knocking it for all my massage
But it can be
therapist
painful.
friends. Yes, it's just, I like a gentle touch, whatever, Anyway, Jesus, help me. Okay, change back.
So inflammation is also associated. It is a driver of almost all disease processes. So inflammation is associated with cancer.
Right.
It's associated with, what am I thinking about? Any other chronic diseases? It can proliferate and prolong these chronic diseases.
So we're talking about inflammation in like a negative way, not in where you're, initiating an immune response. And so...
Correct. Because that will come, that type of inflammation when you're initiating, it is initiation of an immune response, but it's chronic and it's ongoing, and that's not healthy.
Oh, yeah, that's a good point too.
So if it's initiating an immune response that's acute or short term, right, and it hits up and goes down, it helps with healing. But when it stays around, it does not.
Okay.
So one of the things that I see that's kind of a side note with autoimmune disease and inflammation is someone who has autoimmune disease that's really out of balance, and it's not, and when I say it's not managed well, I'm not putting that on the person, like they're not managing well, it's just out of control.
Right. They
can exercise. And instead of, like, if someone who doesn't have a lot of inflammation and autoimmune disease exercises, you're sore for a couple of days but you feel good, and then you recover. The recovery time for them is a lot harder. They'll be down for 7 days, sometimes even longer. They don't feel good after they exercise or push it. They also take a long time to recover, and so then they're in pain that whole time.
Okay.
But so we want to keep inflammation in check, because things like cancer, it can also increase your risk of other chronic diseases. So it's this cycle effect.
Right. So what about, like, you mentioned lupus?
Yes.
And I have some family members a lot of my family members have autoimmune disease from, like, the rheumatoid arthritis, the lupus, those different types of things. I know we talked about celiac last week a little bit. Hashimoto's. So, yeah, we could do that. Could you maybe name some things for people that aren't really familiar with what different things are autoimmune diseases? Or
So, Hashimoto's is a autoimmune thyroid disorder where you're hypothyroid.
Okay.
And
what were some symptoms? Or is it just affect your thyroid?
No. It can affect so many. So anytime you have autoimmune in general, it can affect joint, all over pain. It can affect kidneys. It can affect anything systemically.
Okay.
But for Hashimoto's, it's going to be all of the same symptoms as hypothyroidism to extent. So with Hashimoto's, when you first start, there can be other symptoms like heart palpitations. You can have anxiety and you're not sure why. You can have this fluctuation. Sometimes you have this kind of, it's like a pressure and anxiety, and you think it's related. Some people have said, I feel like I'm dying, when they're really having a thyroid storm. And so that's kind of initial. But as you have it for a while, it's hard to lose weight. Energy is usually down. Sometimes it can affect fertility, brain fog, and all of these all of these symptoms can be cross-referenced to other autoimmune diseases as well.
I was just thinking that because it sounds like so many other ones.
And you can have all of those and not have autoimmune disease.
Okay.
Because it could and that's where it's good to find a functional medicine practitioner to look at really what is going on with you, do the testing, do the symptom, do the history to see what's going on with you.
Right. I guess my question was also because some of my family members have been told that, you have to have all 12 of these symptoms for us to say that you have lupus, but you only have 10 of them, so you don't
have lupus.
You don't have lupus, but all of these are an issue. So you have, sojourns, I think is how you say it, with like Sjogren's. Thank you, with the dry eyes and all of that kind of stuff.
Scleroderma.
Yes, and so or like
sarcoidosis.
They don't. Fingers turning purple and different
Graves'
things
disease.
like that, and Graves' disease as well.
Yes.
So
there's lots of them.
Yes, and so I know so many people that have so many of these things or that fall within these spectrums that not only in my family but that are my clients, that are my friends and family, and I just feel like it is an important topic to talk about because. On the other side of things, as far as doing things to help with inflammation and autoimmune, I know a few people that have hit all of those, not all of the markers, let's say 10 out of the 12, and then they changed their diet and started exercising and started taking supplements and omegas and things to help with their inflammation. And now, not only have they lost weight, they don't have a lot of those markers anymore, and their blood pressure is down and all of those things.
So it's really interesting. Autoimmune disease is sometimes hard to classify and hard to diagnose.
Okay.
So there is a clinical diagnosis, and then there's also diagnostic tests that we can do. But the diagnostic tests, like lab work, is not always really clear. There's some other, like for celiacs, you can do an endoscopy looking at the small intestine. It's a little bit invasive. So there's other things.
Yeah, that's what you're talking about. Either they're like this or they're like flat or something.
Yes. So the microvilli, they can be like finger-like and increase their surface area. They can be flat. So that is really an indicator for definitely that you have celiacs. But by the time that you have that flattened small intestine, your ceiling for improvement has lowered, right?
Right. Kind of like smokers and smokers cough, where like your cilia and your throat should be doing a certain thing, and then you smoke and smoke and smoke, and then you damage them all, and so
you can't recover all the way from some of that.
Right. So now you have to cough to get things out, because your cilia aren't moving things up and out like they should.
And so sometimes, there's testing a lot of people will do. So sometimes at the clinic that I was working, we would do testing where you would look for autoimmune markers. But just because you have an autoimmune marker doesn't mean you have an autoimmune disease. So you can have an autoimmune marker and still clinically not have the disease. So if you get a good practitioner, they will put all the pieces together. They will look at family history, they will look at labs, they will look at history and how you present clinically, and they will put all of that together and be able to say, yes, we think that you have this. I've had patients that come back and say, I've been told I have a mixed connective tissue disease, because they'll have different autoimmune markers and inflammation markers. So one of the things we look at too is inflammation markers. So looking at high sensitivity CRP, so CRP, C-reactive protein, but there's one that's a little bit more accurate. Sometimes erythrocyte sedimentation rate, which they call SED rate, or ESR, is something else they look at for inflammation, but they're not always definitive what's causing. You could be fighting a virus and those markers be up. It doesn't mean you have autoimmune, it just means you have inflammation at that time.
Right.
So it fluctuates. But we can have someone come and do some of that testing, and they're not sure. But all of that you can say, maybe I have this, I have these symptoms. But then the treatment, or what we're going to recommend doing, is very similar, because we're looking at gut healing, we're looking at decreasing that inflammation. And so a lot of things we try and fill in these gaps, like fish oil, like you talked about, or omega-3 fatty acids. A lot of us are deficient, most of us are deficient in those. So that's something that we need to look at. Other than micronutrients, lifestyle, sleep, what are we putting in our bodies, toxins, all of those things play a role.
So does that have anything to do with your inflammatory load? What does that mean? I've heard that term tossed around before.
Toxic load or inflammatory load?
Inflammatory load was, I think, what I've heard.
I don't know if I've heard that one.
Oh, okay. Well, then, great.
I would guess it would be how much inflammation that you have and what's causing it.
Okay, so maybe with the SED rates and the different things that you were talking about, like what your level is with those.
And then
things,
if it's chronic, or so if I have someone and it's really high and then it goes back down, then that might be a virus. We correlate that with symptoms and what they're presenting. I had a patient that had cancer metastasis, and he was in denial about that's what it was. We did lab work, and his C-reactive protein was off the charts. So when you're looking at that, there's flags to say we need to investigate further. But that's where a good clinician, you taking a lab work and just looking at piecemeal doesn't always really give you information. You have to look at the whole picture.
Okay, so what are some different things that people can do? I know you mentioned a couple, but to lower their
inflammation.
And I know, so
I would look at basics is making sure you get all your nutrients, drink enough water, those types of things. We have to have those. Getting enough of your macronutrients, so enough fats, proteins, and carbs. But really, I see people not consuming enough good fats, consuming overprocessed fats, overprocessed carbohydrates. So high sugars will cause inflammation. So getting this diet and lifestyle in check, and there's lots of parts to that.
Right.
But and it's easy to say, and people are like, oh yeah, I know I eat well, but I've talked to people all the time that think they eat well and they don't. And so they're really, when they look at that, they're counting calories, they're looking at carbs, fats, proteins, sodas, but that's not, it's a little more, unfortunately, a little more complicated. It's simple and complicated.
And then those things are also going to help you to, be healthier, right? So when we're talking about the day and age that we're living in now with, the coronavirus and different things like that, and all different types of virus, your body, you should be able to have a strong enough immune system to be able to deal with different bacteria and viruses that are out there.
Because
we live around them all the time. Right.
And,
they're always
getting exposed, even though, and it's healthy to have that reaction exposure. The sad part is when we get sick, and if it even beyond sickness where we are, ill to the point where we may die from those are scary. But typically when we're talking about average, yes, we should have those. So vitamin D is another one that is huge, that we're a lot of times the one that is a very big immune system supporter that helps our immune system. So all of those will help inflammation. So all of those have its part in that inflammation. After I look at that, I look at omegas are huge in reducing inflammation. So what's really, and I'll get a little bit technical with you, what's really interesting is, so with all the fats, and we'll talk about, there's omega out of the essential fatty acids. Essential means we have to consume them.
Okay.
That we don't get them, we don't make them. But it's going to be omega-6, 3s, and 9s. And we talk about mainly omega-6s and 3s because most of the fats that we eat are omega-6s.
Okay.
So this is going to be our nuts and our seeds and some of our oils.
Okay.
Omega-3 fatty acids.
Bye, girl. Come on.
Omega-3 fatty acids are found in things like cold water fish like salmon.
Okay.
They're also found in mackerel. They're found in krill. They're found in grass-fed dairy products. So the flax seeds, chia seeds, walnuts, those are where we're concentrating, and hemp seeds, omega-3s. But the problem in our culture is our bodies are made to consume those at a 1-to-1 ratio, meaning we should be eating omega-6s and omega-3s at the same rate. But how many people do you know consume the same amount of those omega-6 fats compared to omega-3s? So all of the short name list of the omega-3s, we don't eat very much of those things.
Okay.
If we're eating beef or dairy, we're eating grain-fed and processed. We're not eating organic, full grass-fed, right? So that's a problem. And then we're talking about all of the fats that we eat are going to be omega-6. So when there's not a balance, then there's an overproduction in arachidonic acid, which is going to cause inflammation. So what I see is typically the standard American diet, 25 times more omega-6s than omega-3s when it's supposed to be 1-to-1. In someone who's trying, what I see a lot of times, we can get it down to 5-to-1 and 3-to-1. That's what I typically see. If it gets down to 3-to-1, I'm happy, because it's very difficult to get close to a 1-to-1 ratio in our culture because of what we eat and how inflamed. So that is a huge thing that can help. So omega-3s, even though it's not 100% true to say it this way, but in general for our culture, omega-3s are anti-inflammatory and omega-6s are pro-inflammatory. In and of itself, omega-6s aren't. It's the balance between the two.
Interesting.
So that's another way. There's other things like turmeric that people talked about with that is there's different forms of turmeric, curcumin, all of those things. And so that's something else that can be helpful. I don't know a lot of the research behind it, but I know like CBD oil can be anti-inflammatory as well. So those are a lot of the things that...
So even with that, then still we're talking about, our diet. And unfortunately with the standard American diet, right, it sets us up for not being healthy because we're not getting the nutrients that we need from our food. But then also you have to talk about, quality supplements, right? Because I feel like what I see a lot of too is people will say, well, I take this, and this, and you're really not seeing any evidence of them taking those things because it's not a very absorbable product or it's not a quality product.
Correct.
So, can we talk about that a little bit just for people that want to, if you really are trying to lose weight and take supplements so that you can have the nutrients that you need and so that you feel good, right? I feel like so many people just don't know what it means, you know, to feel good.
Which is sad, because I will say, and a lot of you guys watching, because I know you, I'm looking at who's watching, are about our age.
Right.
So we're talking about...
I have one that's not. She's about half my age, but she's super sweet.
But you can see... But, you know, we're in our 40s, and a lot of times I hear a lot of people our age say, oh, I'm just getting old. And I'm looking at them like, what do you mean?
We're not getting old. I just made... met a new lady. She's super awesome. Her name is Erin, and she is a gerontologist. And so what that means is that they basically work with older people. Mm-hmm. And she was saying that so many people will say that they're old in their 70s. And she's like, you're not old. She was like, don't say you're old to me until you're at least 90.
I say that.
You know, because you're...
And I know some 90 years olds
that are doing that aren't old. And also people think that, you know, having pain is a part of aging. It's normal. Yes, or getting disease is a part of aging.
Correct.
And it's not. Having Alzheimer's, having dementia, these are not
it's
things...
like, oh, I'm getting old, it's just the way it's supposed to be. And that's not the truth.
And we've given them names. You know, our culture has gone as far as saying, oh, you got old-timers disease. And you shouldn't, right? Dementia, Alzheimer's, we call it old-timers disease. And those are not things that, you know, that you should have. And so there's several studies out now that are actually tying Alzheimer's and dementia to your gut health, which is really interesting as well. And diabetes. So
they've coined it type 3 diabetes a while back. Alzheimer's.
What?
Yeah,
Never
because the high blood sugars affect your brain and brain inflammation. It's all about, and Alzheimer's is related to brain. So again, inflammation, brain inflammation.
Right.
And our brain, even if it's not talking about inflammation, is made up of mostly fat. So there's something else to think about as well. But yes, so when we're talking about supplement quality, the worst thing you can do is buy something thinking it's helping you, and it's actually either harming you or you're just throwing your money down the drain, or both.
Right.
So that's where there are some over-the-counter supplements that are great that you can get, but it's hard to know. We might do a segment on just talking about supplements, and I can give the website to look at. We can talk about some. We have to be careful. I don't want to name drop too many because I don't want to, but we can talk about how to look for if something's good or not. You can also just contact me and I'll tell you, but I don't want to do it on a platform. Right. You know, what I would think about quality supplements. It is very important. I have seen lab tests from people who take not quality supplements versus quality supplements, and there is a difference. Or if they've switched, there's absolutely a difference. And then not even said it's not helping some of them. So a lot of the vitamin D and even fish oil will add soybean oil. They will add other things to that are actually detrimental to us, that are hurting us. They're giving us toxicity. The other thing is really interesting. I had a patient that I was selling a fish oil supplement. I sell a certain quality of a fish oil supplement only, and they were not wanting to pay the price for that. And typically with supplements, you do get what you pay for. It's not 100% accurate, but it's for the most part. And she said, well, let me bring the one I brought in. I just get it from Walmart because that's all I can afford right now. She brought it in, and it was really interesting. The ingredient wasn't even fish. It was the fish body oil, and I don't know exactly what that means.
Okay.
And then the other thing is when I compared the amount of EPA and DHA she was getting, which is the two forms of omega-3s. It's not the only two, but two that we utilize as humans in our cells. She was paying more per milligram of that for what she was getting than she would have mine. So even though she thought, because out of her pocket was coming a little bit less money, she was actually spending more money for a very poor quality supplement. Right. So it wasn't really helping her. So if you're talking about needing help with A, B, C, D, what is the point of taking something that's not going to help, right?
And I think a lot of that too, I will say, you know, you mentioned a place where you could buy stuff from. I know there's a few supplements, because I feel like places like Target and Walmart are changing, you know, as far as carrying better things. And of course, you know, like she said, it's just going to be a different... It's different when you're buying something from somewhere that specializes in a thing versus somewhere that specializes in something else. So
Yes.
I mean, I guess I'll just throw it out there like that. But you want to make sure, I feel that way a lot about herbs and things like that, because I'll have moms that'll say, oh, I've been taking this tea and I haven't seen any differences. And so then when I ask them, well, how much tea are you drinking? And they'll say, oh, well, I'm drinking a couple of cups a day. But then when you actually read the box at the serving size, it says, serving size is like 2 tea bags 3 times a day. You know what I mean? And so or 3 to 5 times a day. If you're taking that much, then you're going to be through that box in like 2 days. So if you were to buy a more quality supplement or get your herbs, yourself in bulk and make a tea or something like that, then you're going to be able to stretch your dollar, a little bit further. You may feel like you're spending more up front, but really if you were to buy the amount of tea boxes that you would need to get a therapeutic dose of that herb, you'd be buying, you'd be going through a box every 2 days, to really get what you need.
So you're spending more money. It's it's that perception of marketing and getting a good deal, and so and that's where I tell people, we really need to figure out what's really important to us. And our health, until you lose it, sometimes some of us don't think it's important. Right. But then it is so important. And I talk about it all of the time. And it's really, really disheartening to see when someone doesn't take that or heed that advice. And then when something happens and they are sick and it's here, it's like, I wish they would have taken that advice. And sometimes it doesn't take but 1, 2, 5, but you know what I mean? Mm-hmm. And it's like, these things could be prevented. Not everything can be prevented, but we can give our bodies a better chance at functioning the way we want them to function.
Having a healthy immune system is priceless.
It's priceless.
It is. So, when you're talking about what you want to choose to spend your money on, your health, either you can take care of yourself now or you pay for it in medical bills later, and decrease quality of life and not being able, to see your grandkids grow up and those different types of things. So it's really important to understand that, I feel like I say all the time that, older people, my grandma used to always say, you are what you eat. And we got away from that, but you really are. You know what I mean? Literally, you are what you eat. And what you put in your body is very, very important. And it's going to help with inflammation. And you want to have, yes, we want that inflammatory response to be able to do what it needs to do. We want your body to work the way that it's supposed to work. So if you have an insult to it, an acute insult, then yes, we want that inflammation there. But if you have this chronic insult, then we want to fix the chronic insult so that the inflammatory response isn't just, going on continuously and damaging your body.
There's not a check there to be able to do that. And there's a freedom in there's a freedom in health. Like when we get older, ask any older person that can or can't do it. There's a freedom. When I say older, I'm talking about 80s and 90s, that there's a freedom in being able to continue to drive, to be able to participate in your grandchildren, children's family, friends,
maybe
lives.
Even your great grandchildren. Maybe if you're in your 90s,
or even just with friends, or even with I have a little funny story. It's not funny, but it's kind of sad. But I have a patient that she's in her 80s and she's in great health. She takes care of herself. She has fun. Her husband passed away a few years ago. She's having a hard time finding a partner, just someone to do something with, because they're all unhealthy.
Right.
And even if she went 20 years younger to in their 60s, they are still too unhealthy for her. And that says something, you guys, about how our health is and what we think about health. I don't know how many 60-year-olds will say, I'm just too old. And I'm like, what? Like, I'm going to tell you, when I'm 60, I'm not going to be old. I'm going to be vibrant. I'm going to be doing all of those things. Because I am enjoying it. enjoying. I mean, how can you not? As long as I'm on earth, I want to be able to enjoy my life and enjoy other people.
I mean, you know, it's people don't look at that, you know, a lot of times, even biblically, you know, it says that man's years are 120. So we should be making it at least there, people. We're not
even close.
Yeah, we should be making it at least to 120. And that means being whole. That does not mean not being able to think for yourself. That does not mean having to have, you know, people take care, you know, all of the things.
And we know things happen.
Of course.
You know, and so there's things that happen that we do need other people to take care for us or help.
Yes,
but we got to give ourselves the best chance.
You have to give yourself the best chance. And I guess the point that I'm trying to make is being able to have a good quality of life. Yes. Because I believe that none of us, yes, things happen, but things happen to young people too, and they have to be taken care of. You know, if you have an accident and something happens to you, then you have to be taken care of. But you want to be able to be of sound mind and body, you know, when you are older. And that is definitely doable. It's definitely attainable to be able to exercise, to be able to think clearly, to make decisions, you know, and all those things at an older age.
Agreed.
And
so inflammation plays a part in all of that. The longer you have chronic inflammation, the more broken down your body will be overall unless you do something about it. So diet and lifestyle is huge for that. There's some herbs and other supplements that can be helpful. Make sure you get quality supplements. Some of the things, too, that we talk about, and there's some links to stress and inflammation. And some of the things with stress, it's not just how stressful your life is busy, but do you have good connections and good relationships in your life? Enjoying other people is a huge one. I know some of you introverts are like, oh my gosh, I really don't. But you have people that you enjoy. You don't have to go be a big party or anything. And so those are things to enjoy life, and that is a part of decreasing inflammation as well as having fun.
Yeah, because being in fight or flight all the time is not where you need to be, right?
And there is a response in our body physiologically that produces inflammation whenever.
Whenever we're there. So we are going to start trying to cut these into smaller chunks for everybody. We will not. You're going.
I'll be.
Yes.
Yeah,
so
I'll be here
next week and
the week after.
The next 2 weeks.
We might do it on a different day, but.
Oh yeah, that's an idea. We might get together and do it on a different day, but we won't be here next Friday. Yep. So we will continue to talk about. What are we talking about next?
We talked a little about autoimmune diseases.
Oh, yeah.
So maybe we were going to talk about.
I don't know.
There's so many things.
We
could talk about picking quality supplements.
Okay.
We can do that, and unless there's something that somebody else wants to, or if we have a really good topic, you know what we could really talk about?
Do you want to bring some, or how do you want to do that?
We can do that. The other thing we could do is we can maybe sidetrack and talk about do we talk about immune system yet? How do we boost our immune system? Because in this, with pandemic, why don't we talk? Because here's the thing, and I'll make this as a side note with this. I'm not going to get into the no mask debate, all of that, because we want to do the things that's healthy. What I would talk about is what can we do individually without having to tell somebody to do or not to do. If they're not being responsible or whatever we believe, we can't control that.
Right.
We need to control what we can do, and so what can we do to give ourselves that best immune system boost? So maybe that would be good. And we'll incorporate some of the things we've already talked about, like gut health and decreasing inflammation.
No, 100%. So I think talking about immune system health and how to boost your how to boost your immune system. My family are making cameos in tonight's production. But yeah, we'll talk about your immune system, how it works, what it is, and what we can do to boost your immune system.
And then I can give some specific things about COVID. They have some on a functional medicine perspective.
Yeah, I think that'd be a great talk.
Yep.
So we will be talking about that in a couple of weeks. So Thank you guys for joining us, and we will see you next time. Everybody have a blessed weekend.
Bye.
Bye.
We're not off yet, Zay. How do I turn this off? Oh, yeah.
Hello. Okay, hold on in that one.